Have you ever wondered what VA disability for tinnitus is? Today, we delve into this important topic that's particularly relevant to many veterans. Tinnitus is a medical condition characterized by the perception of noise or ringing in the ears. It's not a condition in itself, but rather a symptom of an underlying condition, such as age-related hearing loss, an ear injury, or a disorder in the circulatory system. This phantom noise can vary in pitch from a low roar to a high squeal, and it may be present in one or both ears. In some cases, the noise can be so loud that it interferes with the ability to concentrate or hear actual sound. Tinnitus is generally divided into two types: subjective tinnitus, which is tinnitus only you can hear, and the less common type, objective tinnitus, which is tinnitus your doctor can hear during an examination. Often described as a ringing in the ears, it can also sound like buzzing, hissing, humming, clicking, or even music. Tinnitus is a common problem and affects about 15 to 20% of people. It's especially prevalent among veterans, with the U.S. Department of Veterans Affairs reporting that tinnitus is the most claimed disability among veterans. It's important to note that while tinnitus can worsen with age, it may be improved with treatment. Addressing the underlying cause, if identifiable, can help alleviate the symptoms. Treatments can also help lessen the perceived intensity of the noise, making it less noticeable and less disruptive to your daily life. Whether you're a veteran or not, understanding tinnitus and its implications is the first step towards managing it effectively. As we continue this discussion, we'll explore the causes of tinnitus, how the VA rates this condition, the process of claiming conditions, what to expect at exams, and the resources available for those who need to appeal a claim. So, stay tuned, hit the like button, and subscribe as we unravel the intricacies of VA disability for tinnitus. Understanding tinnitus and its implications is the first step towards managing it effectively. So what causes tinnitus? Well, tinnitus isn't a condition itself, but rather a symptom of several potential underlying causes. One of the most common culprits is prolonged exposure to loud noise. This could be a one-off event, like a loud concert or explosion, or it could be the result of consistent exposure over time, such as working in a noisy environment. Ear infections can also lead to tinnitus, as they may cause inflammation and increased pressure within the ear. Certain medications, particularly those used for cancer or heart disease, can have tinnitus as a side effect. Some people might even experience this ringing sound as a result of age-related hearing loss. It's important to remember, though, that tinnitus can sometimes occur without any apparent cause. It's a complex symptom that can stem from a variety of factors, and understanding these factors is the first step towards managing it. Now that we know what causes tinnitus, let's delve into how it's rated by the VA. So, how does the VA rate tinnitus? This is a question many veterans grapple with, and today, let's talk about it. The Department of Veterans Affairs, or the VA, uses a rating system to determine the severity of a veteran's disability and the compensation they're entitled to. This system is based on a scale of 0 to 100%, in increments of 10. Each increment represents a degree of disability, from mild to severe. When it comes to tinnitus, the VA generally awards a 10% disability rating. This is because tinnitus is seen as a subjective condition, meaning it's based largely on personal reports rather than objective medical evidence. The VA recognizes that while tinnitus may not be physically debilitating, it can significantly impact a veteran's quality of life. The 10% rating is the standard, regardless of whether the tinnitus affects one or both ears. It's also important to note that the VA does not award multiple ratings for tinnitus, even if the condition is present in both ears. This means that the maximum disability rating for tinnitus is 10%. So, what does a 10% rating translate to in terms of compensation? As of 2024, a single veteran with no dependents and a 10% disability rating is eligible to receive approximately $171.23 per month. This amount is adjusted annually to account for cost of living increases. While this may not seem like a substantial amount, every little bit helps. And it's vital to remember that tinnitus is often associated with other service-connected conditions. If a veteran can establish a link between their tinnitus and another disability, they may be eligible for a higher overall rating. Understanding the VA's rating system for tinnitus isn't just about grasping the numbers. It's about acknowledging the impact of the condition on a veteran's life and ensuring that they receive the support they deserve. How do veterans claim their conditions, and what should they expect at the CNP exam? To claim a condition like tinnitus, There are several steps to take. First, you must complete the necessary paperwork. This includes the Veterans Affairs Form 21526-EZ, also known as the Application for Disability Compensation and Related Compensation Benefits. This form is a crucial part of the process, as it is where you'll detail your conditions, explain how they're connected to your service, and provide any supporting evidence. Once you've filled this out, you'll need to submit it to the VA. You can do this online, by mail, or in person at a local VA office. Remember, it's crucial to be as thorough and accurate as possible when filling out this form. Vague or incomplete information can delay your claim or even lead to a denial. After you've submitted your claim, the next step is the Compensation and Pension, or C&P exam. This is a medical examination conducted by a VA healthcare provider or a VA contracted provider. The purpose of this exam is to evaluate the severity of your condition and how it affects your daily life. During the C&P exam, you should expect to answer questions about your medical history, current symptoms, and how your condition impacts your ability to function. The provider may also perform a physical examination or other tests, depending on the nature of your condition. It's important to be honest and upfront during this exam. Don't downplay your symptoms or struggles. The more accurate and detailed you are, the more likely it is that your claim will be evaluated accurately. Let your examiner know when your tinnitus started and how often it occurs, what your job was during military service, and how tinnitus affects your social and work life on a daily basis. Remember, the C&P exam isn't a regular medical appointment. Its purpose is to evaluate your claimed conditions for disability compensation. Therefore, treatment or medication prescriptions aren't typically part of this exam. It's strictly an evaluation. Being prepared for the claim process and the C&P exam can make a significant difference. Understanding the steps involved, filling out your paperwork accurately, and being honest during your C&P exam can help smooth the path to getting the support and compensation you deserve. What if a claim is denied? What resources are available to help? These are questions that can loom heavy on the minds of those who have submitted a VA disability claim for tinnitus. But fear not, there are clear steps to follow and resources available to support you through the process. Firstly, if a claim is denied, the reason for this will be detailed on the claim notification form. It's important to thoroughly review this document, as it provides valuable insight into the VA's decision-making process. It might be that there is a lack of medical evidence supporting your claim, or perhaps there's a discrepancy in the paperwork. Understanding the reason behind the denial is the first step in crafting an effective appeal. When it comes to appealing a denied claim, there are a few avenues to explore. You could request a higher-level review, where a more senior VA official will reassess your claim. Alternatively, you could opt for a supplemental claim, where you can submit new and relevant evidence to support your case. There's also the option to have a hearing with a veterans law judge at the Board of Veterans Appeals, which is often the route taken for more complex cases. Now, navigating the appeals process can be a daunting task, but remember, you're not alone. There are many resources available to help. The Veterans Benefits Administration, for example, offers a wealth of information and guidance on their website. There are also numerous nonprofit organizations, such as Disabled American Veterans and the American Legion, that provide free professional assistance to veterans filing claims or appeals. If you're more comfortable with one-on-one support, you might consider hiring a VA-accredited attorney, claims agent, or veterans service officer. These professionals specialize in VA claims and appeals and can provide personalized advice and advocacy. Remember, support is always available and no one has to navigate this process alone. Whether it's through online resources, nonprofit organizations, or professional assistance, there is a wealth of support out there ready to assist you in your journey towards a successful appeal. In conclusion, we've traversed a significant amount of information today. We've explored tinnitus, a medical condition characterized by a persistent ringing or buzzing in the ears. We've delved into its causes, ranging from exposure to loud noises to certain medical conditions. We've also shed light on how the VA rates this condition, using a percentage system that correlates with the severity of the condition and the impact it has on your daily life. We've discussed how to claim conditions and what to anticipate at the C&P exam, a vital step in the VA's disability evaluation process. In case of claim denial, we've highlighted how to understand your notification form and the best strategies for appeal. Moreover, we've pointed out some of the best support resources available for veterans going through the appeal process. With the right information and resources, managing tinnitus and navigating the VA's disability system can be a smoother process. Thank you for watching, and remember, you're not alone in this journey. Please share this video with fellow veterans who will find this video helpful. And check out more of our videos and resources that may be helpful to you in the description box below.